Hi, my name is Dr. Sebastian, and I will be leading your tour today. Because of COVID-19, we are no longer able to do tours in person. So this is an opportunity to be able to tell you about our practice and North Austin Medical Center. We have been practicing out of North Austin Medical Center for the last 14 years and have been really thrilled with the care that can be provided in that hospital. The Women's Center of Texas was built over 10 years ago. It has 29 labor, delivery, and recovery beds, and it's the largest L&D unit for all of Central Texas. It does about 25% of the births of all of Central Texas, and that size brings some great things with it. Because of the size, we can have 24/7 in-house anesthesia, as well as 24/7 in-house neonatology and neonatal nurse practitioner. Hopefully, when we birth, we don't need to have the Nicu, but thank goodness that it's there, because there are those emergencies that happen where the Nicu is invaluable. We also have 24/7 maternal fetal medicine on call. Those are the high-risk obstetricians that help with unusual, complicated problems that can arise in pregnancy. What you see currently is the Atrium, or entrance to the Women's Center of Texas. This area is where you will come when you're in labor. If it is after hours, there's a doorbell on the outside that you will press in order to gain entry. You will go to the elevators and go up to the top floor, and there you will find labor and delivery. Once again, there's a doorbell there that you push in order to gain entry to labor and delivery. The OB emergency department is also on labor and delivery if you were to have an emergency while pregnant. All patients that are 14 weeks or further along in pregnancy are seen in the OB emergency department with any issues that might arise. Now we're going to go upstairs and see a labor and delivery room. Usually in the tour at this point, I show people the waiting room for labor and delivery. The waiting room is a lovely space, but it is not very large. And I always like to remind people that labor lasts a long time. The typical first-time mom active labor is 12 hours. Oftentimes grandparents are very excited about getting to meet their first grandbaby, and they come to the waiting room. And they may be sitting there for 12 hours, and they often can get quite anxious. Because of that, you often see frequent phone calls from those people wondering where the baby is when that process of labor is going completely normally. So it's important to talk with family members about when to have them come to the hospital and what the expectations are that you and your partner have for your birth. Sometimes people find that they have family members that want to come, and maybe you don't want them to come. We are always happy to help communicate that to family members if you would prefer this time to be a private one with you and your partner. So now you see a typical labor and delivery room. These rooms are quite spacious, and they have a labor and delivery bed. This bed we often call the transformer bed. The reason we call it that is that it can change into many different positions to allow you to labor sitting, side-lying, squatting, ultimately what feels instinctive to you. While in labor, we have to monitor the well-being of your baby. If you're a low-risk pregnancy, we do that by monitoring 20 minutes out of every 60 minutes to make sure that your baby is tolerating labor well. That can be done with you standing, sitting in the bed. It does not require you to be lying flat in the bed. For moms that are high risk and require continuous monitoring, that still can allow you mobility. The continuous monitor has quite a long attachment to the main monitor itself, and it can allow you to sit, stand, be hands, knees in your bed, all while you're being monitored. Sometimes it can be helpful to rest a hand on the monitor so it maintains better contact with your belly so that the monitoring can be continuous. This will allow the nursing staff to feel more comfortable with your mobility because they're able to ensure that your baby's doing well throughout your labor. In a typical birth, when the baby is born, it goes straight to mom's chest. You're able to do skin to skin immediately and delayed cord clamping. Those are the routine practice for us with every birth. Once the cord stops pulsating, we clamp and cut the cord, or your partner may want to cut the cord, and then the baby can be brought higher on the chest to nurse. We like to look for signs that the baby's interested in nursing, which are called rooting. All of the nursing staff in the hospital, as well as our providers, are trained to be able to assist with breastfeeding. In addition, the hospital has lactation consultants on staff that see all patients on the day after delivery to help with problem solving any issues that you might have. The baby's weight and vital signs can be done right in the room, where there's a warmer that also doubles as a scale. That does not have to be done immediately at delivery and can be delayed up to 2 hours after birth. The goal is to make sure that your baby gets on the breast in that first hour of life, what we like to call the golden hour. Medications such as vitamin K and erythromycin ointment can also be done at that 2-hour mark. After you deliver, you will typically spend about 2 hours in your labor and delivery room to recover. During that time, your nurse will be rubbing on your uterus and checking on your bleeding to make sure that you're not bleeding too heavily. After that time, you'll be moving to a bed on postpartum. These rooms are much smaller than the labor and delivery rooms, but still allow not only a bed for you, but a bassinet for the baby and a pull-out couch for your spouse. The hospital provides basic essentials for you and your baby, including diapers, toiletries, as well as gowns for mom and onesies for the baby. The default in the hospital is for the baby to room in with you, and anytime that the baby is to leave the room, the baby can always be accompanied by a parent. The other default is that the baby will be breastfed. And if you are considering formula feeding your child, that you will have to request specifically. There is formula available in the hospital if you were to need it. Similarly, pacifiers are not offered unless requested. Typically, patients that have a vaginal birth stay approximately 36 to 48 hours postpartum. For patients who have cesarean sections, they typically stay 2 to 4 days postpartum. The decision of when to go home really depends on how well you're recovering from your birth. We make that decision in conjunction with you, as we do also with the pediatrician who's caring for your baby. Some patients hope to go home from the hospital early, and one thing that can help facilitate that is having a private pediatrician that will see you in the hospital. That pediatrician is going to be able to schedule you to be seen outpatient, so that if you hoped to be going home earlier, that they can then see you the following day in their office. Here you can see a picture of the nursery. In the nursery, the baby's daily weight gets done. We check weights every day to ensure that the baby is not losing weight too quickly while we're waiting for mom's breast milk to come in. Other things that might be done in the nursery are the state screen, which looks at metabolic disorders. That is done by a heel prick that is required by state mandate. Most babies, though, will spend very little time in the nursery. Here you can see a picture of the Nicu, or Neonatal Intensive Care Unit. The Nicu is where babies go when they need more intensive help, whether that be because they are having difficulty with their breathing and they're breathing too quickly, or they're having difficulty managing their sugar levels, or they're premature and they require greater support. We never want to have our baby in the NICU, but thank goodness for the NICU, because they save infants' lives on a daily basis. As on postpartum, everyone believes that breast milk is best, and even with a baby in the NICU, any pumped milk that you give them is considered liquid gold. And you will want to be pumping immediately postpartum and about every 2 to 3 hours throughout your stay in the hospital, as well as when you get home, to make sure that you're providing enough milk to give to your baby. When you do go home, you're going to want to make sure that you have a car seat that is properly installed in your car. You can sometimes visit your local fire department to have this checked. If you were to have a premature baby that's smaller, then a car seat study will need to be done to ensure that the car seat is an appropriate fit for your smaller baby. When you go home, we also want to make sure that you're keeping an eye out for any problem symptoms, such as fever, heavy bleeding, or worsening pain. All 3 of these things are not normal, and you would want to call us right away. If you are scheduled to have a primary or repeat C-section, then you come in 2 hours prior to your surgery time During that time, you will be in the preoperative holding area where you will meet your nurse as well as the anesthesiologist. They will have you sign consent forms, place an IV, draw some basic labs, and talk you through the process of getting a spinal, which is the type of anesthesia used for planned C-sections. The C-section itself tends to take about 45 minutes. And from the operating room, you move to the post-anesthesia care unit where you will recover for about 2 hours. From there, you move then to a postpartum room. We do all of our C-sections as family-centered, which means that when the baby is born, we do delayed cord clamping, usually for about 1 minute. We drop the blue sterile drape down while the baby is still connected via the umbilical cord in order for you to see your baby. After the cord is clamped and cut, the infant is handed to a nurse who is sterilely dressed. She quickly dries the baby and brings the baby to you to do skin to skin while your surgery is still ongoing. Sometimes it's even possible to breastfeed while your surgery is ongoing. That can be quite difficult though, because as you're lying on your back, it is difficult to see the breast to be able to get a good latch. We always encourage patients to bring music into the operating room, as that helps both to calm the mom as well as to remind all the staff that this is a birthday party. When patients are laboring, sometimes they end up needing medication to help with the intensity of the labor. That can be done with either nitrous oxide or an epidural or IV pain medicines such as fentanyl, Stadol, or Nubain. Check with your provider to see if nitrous oxide is available still at the hospital. About half of our patients hope to go unmedicated through their labor, but the other half do plan to get an epidural. From our perspective, it is important that you are informed of your choices and that you make the choice that's right for you and your family. Many of our patients choose to hire a doula to support them in their labor. We welcome having a doula at the bedside as they provide wonderful support for both you and your partner. With the help of the staff at North Austin Medical Center, we are able to support you through your birth and help you to achieve the goals of your birth plan. Thank you for trusting us to care for you during this very important time in your life. We look forward to getting to see you and your baby.